part of the vertebral artery. First part in neck. So here is the vertebral artery. First part in neck, relation stellate ganglion is in front of it. Stellate ganglion is a sympathetic ganglion at C7 level. Formation: inferior cervical ganglion plus first thoracic ganglion. Second part passes through the foramen transversarium C6 to C1, runs in the groove on posterior arch of atlas, and third part is in suboccipital triangle. Fourth part passes through the foramen magnum, joins with opposite vertebral artery and forms the basilar artery. Stellate ganglion block given at C6 and not C7 to avoid injury to vertebral artery. Atlas. Internal carotid artery. Branch of common carotid artery. Common carotid artery divides at C3, C4, upper border of thyroid cartilage, external carotid and internal carotid. Parts: cervical part, petrous part, cavernous part, and cerebral part. Cervical part in neck, no branches. Petrous part of temporal bone, 2 branches. Cervical part of carotid artery in neck, no branches. Carotid canal. Petrous part. In petrous part of temporal bone, 2 branches. Corticotympani branch and artery of pterygoid canal. Then from superior part of foramen lacerum. Cavernous part. In cavernous sinus, 3 branches, 3 meningeal branches, and 2 trigeminal ganglion branch. Cerebral part, 5 branches in cerebral part. Superior hypophyseal artery, middle cerebral artery, anterior cerebral artery, terminal branches. Anterior and middle cerebral artery. Anterior choroidal artery, posterior communicating artery, and ophthalmic artery. Cerebral artery circulation, cerebral arterial circulations. Anterior cerebral arteries and anterior communicating artery. middle cerebral artery, anterior choroidal artery, internal carotid arteries, posterior communicating artery. This is in the midbrain, pons, and medulla. Midbrain, you have posterior cerebral arteries. Pons, you have superior cerebral artery, pontine artery, basilar artery, labyrinthine artery, anterior inferior cerebral artery. Medulla, you have vertebral artery, posterior spinal artery, anterior spinal artery, posterior inferior cerebellar artery, and foramen magnum. Arteries passing through foramen magnum. Fourth part of vertebral artery. Anterior spinal artery and two posterior spinal artery. Spinal arteries formed in the medulla, passes through foramen magnum, supplies medulla and spinal cord. Divisions: one anterior, two posterior. One anterior supplies anterior 2/3 of spinal cord. Posterior 2 supplies posterior 1/3 of spinal cord. Basilar artery lies in basilar circles on ventral part of pons. Blood supply of medulla. Vertebral artery, posterior inferior cerebellar artery, involves in lateral medullary Wallenberg syndrome. Vertebral artery more commonly affected than posterior inferior cerebellar artery. Anterior spinal artery involved in medial medullary syndrome. Posterior spinal artery, medullary branch of basilar artery. Blood supply of pons. Superior cerebellar artery, pontine branches involved in medial pontine syndrome. Anterior inferior cerebellar artery involved in lateral pontine syndrome. Labyrinthine artery supplies inner ear, branch of anterior inferior cerebellar artery 80%, sometimes 20% branch of basilar artery. Blood supply of midbrain, thalamus, and visual cortex, posterior cerebral artery. Blood supply of cerebellum, posterior inferior cerebellar artery, anterior inferior cerebellar artery, superior cerebellar artery. Circle of Willis. Formed by anastomosis of terminal branches of internal carotid artery and basilar artery at the base of brain. Arteries involved: anterior communicating artery, anterior cerebral artery, internal carotid artery, posterior communicating artery, posterior cerebral artery. Here is the circle of Willis, the base of the brain. Middle cerebral artery is not involved in circle of Willis. Blood supply of cerebrum. Middle cerebral artery supplies majority of lateral surface except frontal lobe, superomedial margin of frontal and parietal lobe, anterior cerebral artery, inferior part of temporal lobe and visual cortex, posterior cerebral artery. Lesion in middle cerebral artery causes Broca's and Wernicke's aphasia. Blood supply of cerebrum. The one in dark purple color is supplied by anterior cerebral artery. The one in purple color is supplied by middle cerebral artery. And the one in green color is supplied by posterior cerebral artery. Broca's area and Wernicke's area are present in the purple area, which is supplied by middle cerebral artery. Anterior cerebral artery, frontal pole, superomedial margin of frontal lobe, parietal lobe, major part of medial surface, anterior 4/5 by corpus callosum. Posterior cerebral artery, P1 segment and P2 segments. P1 segment of posterior cerebral artery gives penetrating branches to midbrain, thalamus and subthalamus. P2 segment supplies inferomedial part of temporal lobe and occipital lobe. Applied aspects: aneurysm in posterior communicating artery, structure compressed is oculomotor nerve. Aneurysm in anterior communicating artery, structure compressed is optic chiasma. Aneurysm in the circle of Willis. Starting from the front, this is the anterior communicating artery attached to anterior cerebral artery, showing aneurysm in posterior communicating artery, which is attached to posterior cerebral artery and then basilar artery. Aneurysm in anterior communicating artery is suppressing optic chiasma, while aneurysm in posterior communicating artery is suppressing oculomotor nerve. We will read this lecture, pharyngeal arches, cleft and pouches, and then solve that MCQs. So it is 1, 2, 3, 4, 5, 6. Only 6 pages, and most of them are diagram. So let's do it. Pharyngeal arches, clefts and pouches. Development. Head bulge, cardiac bulge. Head bulge contains developing brain. Cardiac bulge contains developing heart. Now head bulge and cardiac bulge. In between that you have pharyngeal arches. Future neck. Origin neural crest cells. Secondary mesenchymal or fourth germ layer, plus migrated paraaxial and lateral mesoderm. Pharyngeal arches 6, pharyngeal pouches 4, pharyngeal clefts also 4. Pharyngeal arches are mesodermal thickenings. Neural crest cell more common than mesoderm. And then pharyngeal pouches are endodermal derivatives, and pharyngeal clefts are ectodermal derivative. Pharyngeal membranes are 4. Formed by pharyngeal cleft meeting, pharyngeal pouch plus intervening mesoderm. Pharyngeal membranes are formed by pharyngeal cleft meeting pharyngeal pouch and intervening mesoderm. Derivative of all 3 layers. First forms tympanic membrane, second, third, fourth regresses. So this is a diagram of pharyngeal membrane. The one in orange is a pharyngeal membrane. Pharyngeal pouch is the one in blue, and pharyngeal cleft is the one in red. This is the pharyngeal arch. This is a diagram of pharyngeal arches. Pharyngeal arches 1, 2, 3, 4 and 6, no 5. So inside the blue color is your pouches, outside red color is your cleft. The blue color is coming from endoderm, the red color is coming from ectoderm. Note, fifth arch disappears soon after birth. Pharyngeal arches. Component of each arm. Inside you have endoderm, outside you have ectoderm, and in the pharyngeal arch you have muscle, you have artery, you have nerve, and then cartilage from mesoderm, bones and ligaments, regressed bones. Derivative of first arch, second arch, third arch, fourth arch, and sixth arch. First arch is called mandibular arch, second hyoid. So first arch cartilage is Meckel's cartilage, which forms malleus, incus, majority of skull bones, anterior ligament of malleus, sphenomandibular ligament. Nerve of first arch, it is called mandibular arch, is mandibular nerve. Muscle of mastication, tensor palatini, tensor tympani, myohyaloid, anterior belly of digastric. Second arch, hyoid arch. The cartilage of hyoid arch is Richard cartilage, forms 5S. So what are those 5S? It is stapes, styloid process, stylohyoid ligament, small horn of hyoid, superior surface of hyoid. Nerve of second arch, which is hyoid arch, is facial nerve. Muscle, facial muscles, stapedius, stylohyoid, posterior belly of digastric. Third arch, inferior surface of hyoid, greater horn of hyoid. The nerve of third arch is glossopharyngeal nerve. Stylopharyngeus is the muscle. Fourth and sixth arch, cartilages of larynx except epiglottis. So cartilages of larynx except epiglottis. Nerve of fourth arch is superior laryngeal nerve, and nerve of sixth arch is recurrent laryngeal nerve. Muscles innervated by superior laryngeal nerve is muscles of the fourth arch, which are muscles of pharynx, muscles of palate, cricothyroid. Sixth arch, recurrent laryngeal nerve, muscles of larynx except cricothyroid. Epiglottis is derived from hypobranchial eminence of floor of fourth arch. High yield points. All muscles of larynx derived from sixth arch except cricothyroid, fourth arch. All muscles of pharynx derived from fourth arch except stylopharyngeus, third arch. All muscles of palate derived from fourth arch except tensor palatini, first arch. Middle ear muscles, tensor tympani and stapedius. Tensor tympani is coming from first arch and stapedius from second arch. Digastric, anterior belly, first arch, posterior belly, second arch. All muscle of tongue derived from myotome of occipital somites except palatoglossal, fourth arch. Structures derived from second arch cartilage. So this is the first we will see the structures derived from first arch cartilage. So it is absorbed Meckel's cartilage, sphenomandibular ligament, spine of sphenoid, incus, and malleus. Structures derived from second arch cartilage. You have stapes, styloid process, stylohyoid ligament, lesser cornu of hyoid, upper part of hyoid. Structures derived from third arch cartilage, greater cornu of hyoid, lower part of the body of hyoid. This is from the third arch.
उसके पति के साथ यहाँ आई थी।
शायद उन्हें होश आ रहा है।
मेरे पति कहाँ हैं?
ओह, मैं कैप्टन क्रिएंग हूँ।
नहीं, मेरे पति कहाँ हैं? मेरे पति। कौन कहाँ गई? कहाँ गई वो?
Pharyngeal pouches, endodermal derivative.
उसने खुद को काट डाला और फिर वो उस डॉग के किनारे से गिर गया।
Derivatives of pharyngeal pouches. First, second, third, fourth. Primitive tympanic membrane, auditory tube, palatine tonsil, parathyroid gland inferior, thymus, parathyroid gland superior, ultimobrachial body, parafollicular C cells. Derivatives of pharyngeal pouches. First, second, third, fourth. First, tubotympanic recess gives rise to eustachian tube and tympanic cavity. Second, palatine tonsil and tonsillar fossa. Third, ventral thymus, dorsal parathyroid 3. Inferior parathyroid dragged down along with thymus. Fourth, ventral ultimobranchial body, parafollicular C cells, dorsal parathyroid 4, superior parathyroid. Origin of parafollicular cells, neural crest cells more than ultimobranchial bodies. Applied aspects, Dye-George syndrome, deletion syndrome, deletion of chromosome 22q2. Third pouch fails to differentiate. This third pouch, which gives rise to palatine tonsil parathyroid, which gives rise to ventrally thymus and parathyroid gland inferiorly. Poorly developed inferior parathyroid and thymus. Recurrent episodes of infection due to decreased immunity, decreased calcium levels because of parathyroid. Dye-George syndrome. Pharyngeal clefts, ectodermal derivative, derivative of first cleft, external auditory meatus. Growth from second arch, descends down, fuses with sixth arch, obliterates second, third, fourth clefts, cervical sinus formed. The first pharyngeal arch cleft gives rise to external auditory meatus. Growth from second arch goes down, meets cervical sinus, creates cervical sinus. Applied aspect: branchial cyst, persistent cervical sinus, swelling along anterior border of sternocleidomastoid. Most common location is below angle of mandible. Origin of external auditory meatus, invagination of first arch more than first cleft. Okay, let's try to solve MCQs now. Development of tongue, pituitary gland, palate, and thyroid. Tongue. Anterior 2/3 of tongue develops from first arch, 3 mesodermal swellings, 2 lateral lingual swelling, and tuberculum impar. Lingual swellings, tuberculum impar, first pharyngeal arch, foramen cecum. Posterior 1/3 of tongue, hypobranchial eminence in floor of third arch. So third arch, hypobranchial eminence, scopula. Posterior most part of tongue, hypobranchial eminence of floor of fourth arch. Anterior 2/3 of tongue, posterior 1/3 of tongue, posterior most part of the tongue, epiglottis. Mesoderm of third arch overgrows second arch, fuses with anterior 2/3 of tongue, therefore mesoderm hypobranchial eminence of second arch is not involved in tongue development. Now supply anterior 2/3, general sensation lingual nerve, taste sensation chorda tympani, branch of facial nerve. Lingual nerve, branch of mandibular nerve, nerve of first arch. Posterior 1/3, glossopharyngeal nerve, nerve of third arch. Posterior most, superior laryngeal nerve, branch of vagus nerve, nerve of fourth arch. Note: arches and their nerves. First arch, second arch, third arch. First arch, mandibular nerve. Post-traumatic nerve of first arch. Post-traumatic nerve, nerve of a particular arch. Pre-traumatic nerve, branch of a nerve of a lower arch, regress without remnants except in first arch, forms chorda tympani. Chorda tympani nerve, pre-traumatic nerve of first arch. Second arch, facial nerve, post-traumatic nerve of second arch. Third arch, glossopharyngeal nerve, post-traumatic nerve of third arch. Development of pituitary. Role of the primitive mouth. Third ventricle, neurohypoglossal bud, infundibular process, hypoglossal pouch, Rathke's pouch, mesenchyme. Role of primitive mouth. Development of pituitary, third ventricle, pars tuberalis, infundibular stalk, pars tuberalis, pars distalis, pars nervosa.
Thank you. That's your sheet, Mr. Butler. And this is yours. So morning में 10 बजे होगी basic math periods. Okay? And at 12,
Structure of origin. Rathke's pouch, diverticulum from primitive mouth.
is there a problem? नहीं, कुछ नहीं.
Surface ectodermal. Structural derived adenohypophysis, pars anterior, pars tuberalis, pars intermedia.
सुई की खबर खाएगी कब? सुई की खबर खाएगी.
Infundibular stalk, downgrowth from diencephalon.
आप लोग बहुत लेट हो गए हो.
Neuroectodermal.
Parents book me during their pregnancy. First trimester के बाद.
Pregnancy.
आपके बच्चे को बहुत catch up करना होगा. You understand, right?
Structure derived pars nervosa, neurohypophysis, posterior lobe of pituitary. Note: neuroectoderm, neural tube, brain vesicle, forebrain, dancephalon.
फिर सुना दो बेटा, 2 2 9 सुना दो, सुना दो,
सुना दे
क्या हुआ बच्चा?
सुना दे बेटा बच्चों ने ना सही टाइम पे बेइज्जती कर दी सुना दे बेटा पिया हम कहते नहीं सुनाएंगे मर्जी सुनाती है सुना दे पिया
It's okay. When she's ready ना, वो सुना देगी. चलिए. You know we have all kinds of toys here. Sensory toys, discovery toys, STEM toys, whatever you want. Here.
Development of face.
Ira, your friends here.
Frontonasal process, head bulge, nasal pit, medial nasal process, lateral nasal process, first pharyngeal arch, divided into maxillary process and mandibular process. This is the embryo.
Good morning, Parth.
Embryological origin of face. Upper part of cheek from maxillary process,
आपके sneakers देनी होगी.
which is a part of first pharyngeal arch. Ella of lateral nasal processes,
और सिर्फ
lower part of cheek and jaw from mandibular process, which is also a part of first pharyngeal arch.
आपकी बच्ची का competition.
Philtrum and medial part of upper lip from medial nasal process, lateral part of lip, upper lip from maxillary process, lower lip from mandibular process, bridge of nose from frontonasal process.
ठीक है ये तो हम भेज देते बच्चे को
तो कब से start कर सकते?
Intermaxillary segment.
Training सिर्फ पिया की नहीं, आप दोनों की भी होगी ना?
अरे ना हमारी ट्रेनिंग ना कराओ ये तो बच्ची का एडमिशन है बच्ची बच्ची को कराओ ये मेहनत करेगी आप उनसे पैसे ले लो एक्स्ट्रा
Sure. If that's what you like, Mr. Batra, no problem. नहीं. पर अगर आपकी ट्रेनिंग नहीं हुई ना, तो पिया को अच्छे नर्सरी स्कूल में एडमिशन नहीं मिलेगा. और अगर टॉप स्कूल में एडमिशन नहीं हुआ, then she's not going to get into any good college anywhere in the country.
Intermaxillary segment, maxillary process. Philtrum of lip, maxilla with 4 incisor teeth, primary palate, labial maxillary palatal, component of intermaxillary segment. Intermaxillary segment, philtrum of lip.
And without a good college,
Development of face, medial nasal process, lateral nasal process, frontonasal process, maxillary process, mandibular process. Medial and lateral process form at the margins of nasal process.
जो कराना है करा लो ये आप बताओ करना क्या है
great.
हाँ जी क्या करना है
So the first step is,
Lateral nasal process and medial nasal process.
याद रखिएगा Mr. Batra, this is the first round of elimination. आप एक शब्द से पिया की जिंदगी बन भी सकती है. because
I philtrum is from medial nasal processes and maxillary processes. Fuse as philtrum to form upper lip. Process and structures derived. Process, frontonasal process. Structures derived. Forehead and bridge of nose. Medial nasal process, intermaxillary part of two sides fuses. Components, labial, maxillary and palatal. Structures derived, philtrum, maxilla, medial part and 4 incisors, and primitive palate. Lateral nasal process, ala and nose, lateral part of nose. Maxillary process fuses with medial and lateral nasal process, lateral part of upper lip, maxillary eminence. Mandibular process, lower lip and chin.
पिया बता पिया हैज अ
Maxillary process.
curious nature
Applied aspect. Applied aspect, cleft lip, hair lip, fusion of failure of fusion of medial nasal process and maxillary process. So here is you in yellow color you have medial nasal process
understand.
and maxillary process is the one in green. So failure of fusion between these two causes cleft lip.
She has a maturity about her that is balanced by a bewitching charm and a delightful
Here, medial nasal process is the one in yellow, fuses with maxillary process is the one in green
but most
at the philtrum
to us.
area, and it forms the upper lip.
We are very blessed to have Pia as our daughter.
क्या बात है सर, क्या बात है सर, क्या बात है, ये बात है। अरे सर क्या बात है, पहचान में नहीं आ रही हमारी बच्ची है किसी और की बच्ची है। अरे बेटा बाबूजी किसी दे दे।
Development of palate. Fusion of medial nasal processes. Intermaxillary segment, primitive primary palate. Maxillary process of two sides, palatine process on each side, fuse to form secondary palate.
यार तो impress कर दिया है। अब हमारी बारी।
Applied aspects. Maxilla with 4 incisor teeth, philtrum of lip, primary palate. Fused palatal plates. First, partial cleft lip. Involves only secondary palate. Failure of fusion of palatine processes on two sides. Gap between the two plates, that is partial cleft palate. Unilateral complete cleft palate involves primary and secondary palate of one side. Bilateral cleft palate, Y-shaped cleft between primary and secondary palate, cleft between the two secondary palates as well. Development of thyroid gland. Starting from the top, foramen cecum, thyroglossal duct, hyoid, thyrohyoid membrane, thyroid cartilage, cricoid cartilage, thyroid gland. Derived from diverticulum caudal to tuberculum impar, area from where foramen cecum appear later. Diverticulum descends down to form thyroglossal duct, passes anterior to hyoid bone, divides into two lobes. Tissue proliferates around the lobes. Thyroid gland form, endodermal derivative.
Amazing. आपको तो ब्रांड की दुकान लग रही है।
वो तो ब्रांड की दुकान है, वो तो है हमारी।
Right. हमने सोचा
Osteology of head and neck. Foramens in skull.
आपके पेरेंट्स से अलग ही लगेंगे। Right.
Superior view.
अलग तो आप लोग लग ही रहे हैं। Actually क्या है ना, rich लोग ना show off नहीं करते। Less is more.
Less, more.
Less is more. I'll just call someone who can explain it to you. Hello? Hi, darling. I know you're pretty exhausted after Fashion Week.